Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Don Gaede. He's an internal medicine and vascular medicine physician. His KevinMD article is titled The Dark Side of Medicine, an urgent call to action against greed. Don, welcome to the show.
Yeah, thank you very much, Kevin. Yeah, nice to be here.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you're at today.
Yeah, so went to medical school at Loma University and got my residency in internal medicine and practiced in primary care internal medicine for about 10 years. I honestly got a little bit bored, not really burnt out, but bored, and decided after that period of time to get a fellowship in vascular medicine at Cleveland Clinic. And so completed that in about a year, and then went back to my town in California to practice both vascular medicine and internal medicine. It wasn't busy enough to me just to practice vascular medicine, so I did both. And except for the last few years of my practice in which I was doing pure vascular medicine.
Tell us some common things that you see, common cases that you'll see in the exam room in your vascular medicine practice.
Yeah, so probably the majority of my practice was venous disease, superficial venous disease, varicose veins. I have it myself, my family has it, so it's a real personal thing for me. And so ablating even large varicose veins in the office, as opposed to the previous stripping, is now possible. And it was quite exciting. You could see a patient come in the door with really bad varicose veins, and they could leave a couple hours later without them. So it was fantastic. I also saw peripheral arterial disease. I saw lymphedema, leg pain, leg swelling of various causes, but those were the main issues that I was dealing with in vascular medicine.
All right. So let's talk about your KevinMD article titled The Dark Side of Medicine, an urgent call to action against greed. Now tell us, how did your article come together?
Yeah, I saw this editorial in JAMA, I think it was February, in which Dr. Berwick talks about the problem of greed in medicine, the entire healthcare system, including us physicians, and how it's just pricing many people out of affordable healthcare, even though our healthcare outcomes are very poor compared to many other countries. And so it made me think of instances of greed in which I've seen in my own personal practice, and I wanted to comment about that.
All right. So tell us, what are some of the things that you've seen to make clinicians seem greedy?
Yeah, in my specialty of vascular medicine, the first thing that brought this to mind was the head of my HMO wanted me to review a number of case records from this physician who seemed to be an outlier in terms of the number of procedures, venous ablations that he was performing. And so I reviewed these cases. It must have been 30, 35 cases. And the vast majority, say 80%, were bilateral venous ablations. And I said, this is very unusual. It's quite rare, in fact, to see bilateral greater saphenous vein reflux. And so it seemed very suspicious. I couldn't prove it because I didn't see these patients, but I just told the director that he seems very suspicious that this physician is performing unnecessary procedures. Then I started seeing some patients that had seen another physician. This is a different physician. And they were not comfortable with what he recommended. He was recommending often a bilateral saphenous vein ablation. They'd come in for leg pain, maybe a little bit of leg swelling, not really too much in the way of varicose veins. And so I examined them carefully, including ultrasound. And in several of these cases, I found absolutely no evidence of reflux. No evidence of reflux. And yet I got the records from this physician, and he had reported that there was significant reflux, and it just astounded me. And I saw repeated cases of this. I called up a vascular surgeon colleague of mine. Oh yeah, I know about this guy. And he related a case in which this person had peripheral arterial disease and venous, and he'd already undergone a venous ablation by this physician. As we know, that's an absolutely contraindication to performing superficial venous ablation when somebody has peripheral arterial disease. And I said, I'd like to report this guy to the agencies. And they said, I'd be happy to back you up on that. And I'll just go on a little bit from there. Since I practice both in primary care internal medicine, as well. I saw a number of my patients that were seeing cardiologists, and they'd had a cardiac nuclear examination, let's say 1 year, 10 years ago, but they were having repeated annual cardiac nuclear studies in which the patient was asymptomatic, had a one study which was borderline, but I looked up the recommendation on this and they really were not following recommendations. I also looked up the website Choosing Wisely, in which case cardiologists or radiologists have indicated what's appropriate, and this was clearly inappropriate. So I would actually give the patient a copy of this to take to their next appointment to the cardiologist. And it was a little bit uncomfortable for me, honestly, but I felt it my obligation to my patients to not subject themselves to unnecessary radiation, procedures that might lead to other unnecessary procedures. And I felt a little bit alone in that, in my mission, but I think it's my obligation and our obligation as physicians to advocate for our patients, even in opposition to other physicians who may have other recommendations. But I think, especially as a primary care physician, I felt it my obligation to do so.
So let's talk about the case with the unnecessary venous ablation. So, from the patient standpoint, what are the risks of undergoing that treatment?
Well, it's a very safe procedure, but if you have healthy superficial veins, God forbid, but you might need, let's say, cardiac bypass surgery, in which the case, or peripheral arterial bypass, in which case those veins might be very, very useful down the road. There are occasional cases of DVT resulting from venous ablations. There's cases of skin burn, infections. They're pretty unusual. So it's pretty safe in terms of the patient, but in terms of cost to the patient, cost to the healthcare system, even though it's a minimally invasive procedure, it's just ethically wrong. And we're going down the wrong road if we're doing things on patients that do not need them.
Now, if these venous ablations were in fact unnecessary, is this a particularly lucrative way for that particular physician to make money?
It is. It's quite lucrative in terms of the time involved of doing the procedure, and this physician probably could line them up on several patients in a short period of time. This physician also advertised frequently on television to attract more patients. And many of these patients, a number of the ones that I saw, were not well educated. And so even educated patients, when a doctor recommends something, they were pretty vulnerable to whatever he was going to recommend to them. And so I imagine most of the patients went along with his recommendation, even though a few of them came to me because they felt uncomfortable about the recommendations.
So tell me, what did you do next? Did you end up reporting these physicians for potentially unnecessary tests and procedures? What happened next?
Yeah, so it was a little bit tricky to find out a way to report them. I did call up the local medical board. They had an office in my town, and I told them about this physician. I don't know if there was any follow-up in that case. I also looked for a way to report this physician for Medicare fraud. I had a hard time doing that initially because I wasn't sure if it met the criteria of doing services that were not done. He did a service, but it was unnecessary service. So I wasn't sure if this met that criteria. But eventually I did report this physician. This has been actually about 6 months or so ago, and I've not heard anything back from there's a hotline you can report to the Office of the Inspector General, but I have heard no feedback whatsoever. They said there may be no feedback, but it was a little frustrating to me that I felt unable to do a good job of reporting this physician who I thought still think should be investigated for unnecessary procedures.
Now, in your field specifically with vascular medicine, is this a local phenomenon where physicians are ordering tests unnecessarily? To your knowledge, is this happening across the country? What's your thoughts?
Yes, that was surprising to me as well. I got this. There's a vascular phlebology magazine that put an article out about 4 or 5 years ago saying this phenomenon of doing unnecessary ablations is a widespread phenomenon. And it's very disconcerting to me that so many physicians are involved with this. I think it's because it's a very lucrative procedure, and physicians are simply tempted into engaging in this. And I have to say, personally, I think there's often gray areas. For example, should I order an EKG on a patient that has hypertension? So when you have a fee-for-service system, all of us are tempted by doing procedures on or certain tests that may or may not be necessary, but sometimes it crosses the threshold, crosses the line here, in which it can become a habitual problem for some of these physicians. And it's embarrassing to me as a physician to know that this is so widespread.
Now, from the patient perspective, let's say they see these billboards and advertisements for venous ablation. What kind of questions should he ask that physician in order to make sure that test is truly necessary?
Yeah, that's a very good question. I'm not sure that the average patient has the medical knowledge to be able to ask the right questions to determine whether this physician is telling the truth or not. I suppose the more questions the patient asks, the better. And obviously, the patient should ask, so doctor, why do I really need this procedure? How is this going to help me? Should I get a second opinion? Most patients aren't courageous enough to ask that kind of a question. But it's really, patients are in a pretty vulnerable situation. And I would say ask other patients, ask your personal physician to make sure that this physician that you're seeing is reputable and has been certified in, let's say, vascular medicine or vascular surgery, et cetera.
Now, from a more macro standpoint, what kind of policy suggestions would you make in order to curb this temptation of greed? You mentioned that the fee-for-service system provides these temptations. How would you change that reimbursement system to discourage unnecessary tests?
Well, yeah, I think I would get rid of the fee-for-service system. I spoke about the unnecessary repeated cardiac nuclear tests, and I spoke to some Kaiser physician in my hospital, and he said that often patients will come to him saying, well, I'm ready for my annual nuclear scan. And he had to spend a lot of time telling them why they didn't need that annual nuclear scan. They were going to be fine without that. So I really think, and I have to say, I practiced my entire practice under that system, except for when I got in the HMO, my primary care was capitated. But I think we're incentivized as physicians to do more procedures, and no big surprise, when you incentivize people to do more procedures, pay them more to do more procedures, they're going to do more procedures. And not everybody. Some have, a better resistance to that temptation. But I really think we need to reimburse physicians for quality, taking good care of patients, following appropriate guidelines, pay them well to do that. And I think, in fact, patients or physicians could be paid even better maybe than we are now if we figured out how to do good medical care without doing all these unnecessary procedures. All those procedures are costing the entire medical system a lot more money. And we could really make medical care much more efficient by, in my mind, getting rid of fee-for-service. That's the main objective, but also teaching better medical ethics. I don't know how much that is taught in medical school. I think our medical societies, I was a president of our medical society. I was also very much involved with our state medical organization. I saw very little evidence of resolutions coming forward. Most of them had to do with increasing physician reimbursement. Very few had to do with curbing unnecessary testing and unnecessary physician procedures. And I think that's a problem that needs to be addressed by our state and national medical organizations, because our reputation as physician relies on patients, the general public, thinking of us as honest brokers. And when they start hearing about blatant disregard and dishonesty, it doesn't help our cause whatsoever. And we are thought of as a noble profession, but our nobility, I think, is in serious decline when we have this sort of thing going on.
We're talking to Don Gaede. He's an internal medicine and vascular medicine physician. His KevinMD article is titled The Dark Side of Medicine, an urgent call to action against greed. Don, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Yeah, I think that we need to, whenever we see greed in healthcare, whether it's the pharmaceutical industry, whether it's insurance industry, we need to speak up. We are a trusted source from the general public, from our patients, and so we need to push back against greed. And both outside of our profession and within our profession, we need to clean up our own act. And because most of us, I think, are upstanding, upright physicians that want to do the best for our patients, want to make a decent living, but we need to get rid of the bad apples and make sure those bad apples are brought back into the fold in terms of doing honest, upright procedures that really require medical care. And I think we need to work with our medical associations, our state medical associations, to introduce resolutions to advocate for medical care that doesn't take advantage of vulnerable patients, that ensures that all our procedures that are done are necessary procedures.
Don, thank you so much for sharing your time and insight. Thanks again for being on the show.
It's my pleasure.